Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today the topic of my discussion is clinical features of tuberous sclerosis complex. Hopefully you will learn and subscribe my YouTube channel. The clinical features are epilepsy, intellectual impairment and skin lesion. These three clinical features accounts for 60 to 70% of cases. Onsets of these clinical features usually occur before 5th years of life. Disease may be latent and also seen in adolescent and in adult life. Other features are learning disabilities, hyperactivity, acoustic spectrum disorders, skin abnormalities such as patch of light colored or thickened skin, red acne like spots on face, kidneys are not working properly, breathing difficulties, and hydrocephalus. These problems can range from mild to severe, and it's possible to have only a few of these problems or a wide range of problems. Members of same family may be affected very differently by tuberous sclerosis. This picture describes the appearance of angiofibroma. Angiofibroma appear in between 3 to 10th years of life. Features are red to brown telangiectatic papule measuring about 1 to 10 mm in diameter, extending from nasolabial fold to cheeks and chin area. They are numerous in number and they may form large cauliflower-like mass in the chin area, as seen in this picture. This is another important feature of tuberous sclerosis complex. It is known as the periungual fibroma. These fibroma usually appear 8 hours after the puberty and they look like a flesh colored excretions emerging from nail fold measuring about 1 to 10 mm in length, but they may be large. This is one of the most important sign of tuberous sclerosis complex. It is known as the chagrin patch. These patches are irregular, thickened with elevated soft skin color plaque and they may be found in lumbosacral region. This picture is describing the clinical features of tuberous sclerosis complex. These include erythema, telangiectasis, and acne-like papules in the nose, face, and chin area. Moreover, one of the most important clinical sign is the white ash-leaf shaped macule. It measures about 1 to 3 mm in length, present in the trunk and limb area. It is usually detectable by wood light examination easily. This picture describes the fibroma in the forehead area. This fibromatous plaque is usually noted in the forehead and scalp. Another important feature is the retinal hematoma. It is also seen in 50% of cases in eye region. Moreover, other signs are cardiac rhabdomyoma, which is seen in 50% of cases, GI tumor, for example, hematoma in intestine, colon, polyp are also noted. Diagnostic criteria for tuberous sclerosis complex. There are two main diagnostic criteria. These are major features and minor features. I will first discuss major features. Major features are facial angiofibroma or forehead plaque, non-traumatic inguinal or periinguinal fibroma, hypomelanotic macules, chagrin page, multiple retinal nodular hematomas, cortical tuber, subependymal nodule, subependymal Gantt cell astrocytoma, cardiac rhabdomyoma, and single or multiple, lymphangioma, lymphangiomyomatosis, and renal angiomyolipoma. These are the major features of tuberous sclerosis complex. Moreover, minor features are multiple randomly distributed pits in the dental enamel, hematoma, rectal polyp, bone cyst, cerebral white matter migration line, gingival fibromas, non-renal hematoma, retinal achromic patch, and confetti skin lesion, multiple renal cyst. For the definite diagnosis, tuberous sclerosis complex use two major features and one major or two minor features. For probable diagnosis, one major feature and one minor feature. For possible diagnosis, either one major feature or two or more minor features are required. Investigation. Investigations include medical history, review of family history and septum, physical examination, assessment of skin lesion and other characteristic features, imaging test which include CT and MRI, scan to identify tumors in brain, kidney and other organ, eye and skin examination, specialized examination to detect tumor or abnormalities, EEG to assess brain activity especially if seizures are present, genetic testing, blood test to identify mutation in TSC1 to TSC2 gene confirming the diagnosis. A definite diagnosis typically requires the identification of specific major and minor features associated with TSC. Management. Management usually include pulse dye vascular laser having wavelength of about 595 nanometer produces redness. Another treatment option is CO2 laser and debriding techniques in first instance for more papular and nodular lesion. Topical rapamycin 1 to 2 percentage in concentration in cutaneous angiofibroma. Systemic rapamycin in a case of Vial tumor neurological complications are used. Moreover, neurosurgery in case of uncontrolled epilepsy is also the management of choice. Thank you very much. Stay connected and subscribe my YouTube channel.